Welcome to today's episode of Molecules to Medicine podcast. For those of you just joining the podcast, we are AI Jules. We specialize in helping healthcare and life science companies scale their business and revenue and explore how AI is reshaping the industries and accelerating innovation. So if you'd like to learn more on how to take your business to the next level, make sure you stick around. And if you're interested in a free growth consultation, just drop us the word growth in the DMs and we'll get back to you. I'm your host, Hardy, and today we have a very exciting guest for you, Chris Hutchins, the CEO from Hutchins Data Strategies. Welcome, Chris.
Glad to be here, Hardy. Thanks so much for having me.
And where are you talking to us from today, Chris?
I am in Nashville, Tennessee.
Fantastic. So, Chris, let's jump straight into it. Tell us a bit about your background and the journey that led
Sure.
you to Hutchins Data Strategies and any pivotal moments or experience that shaped your career.
Well, thank you so much. I kind of grew up around healthcare. When I was in high school, my mom was working, running actually a function that doesn't exist anymore. She works in a radiology department at a hospital, and they had a file room, and it was massive. They had these big packets of X-ray films. And I worked part-time on weekends and school vacations and things like that for the last few years of high school. I actually had a chance to do that for a good solid year afterwards before I went on to college. One of the things that was really significant about that whole experience is that was really where I got to see the relationship between patients and the providers, but actually even broader is really more all the other services that were wrapped around healthcare and how we take care of people. One great example I'll tell you, because it really was a pivotal moment for me. There was a particular orthopedic surgeon who had a stellar reputation, but he could be a little bit rough around the edges sometimes. And if I couldn't find his films, he would be agitated with me. One of those occasions, and I finally got what he was looking for, and he kind of went off in a huff. So I think he was headed to the OR, but he turned the corner, and one of his patients was right there. The man's countenance changed immediately, and what I saw was just something I've seen over and over and over again. These people who sacrifice so much to become a physician, or clinicians in general, the Hippocratic Oath is a big deal to them. First, do no harm, right? But the patient was the only thing that mattered to him in that moment. And that to me left a mark that actually caused me to continue to want to be around healthcare and figure out a way that I can actually support what they're doing. So, this is fast forward over 30 years later, I'm still working in the healthcare space. I've had wonderful opportunities to work in some unbelievable organizations that happened to be what eventually became Dartmouth Hitchcock Medical Center. It's up in New Hampshire. I worked for a number of years, about 15 years there. Then I was another 15 years at Mass General, working for the physicians organization, primarily with the first part of it. Eventually got into some data warehousing things, and uh, I learned the ropes from one end to the other in terms of the business operations through the IT area, and then eventually got into the data and analytics. Towards the end of that period of time, did a major Epic implementation, which was uh, quite an interesting experience. I'm sure there's a lot of people out there that have gone through that, but it's definitely an exercise when you're dealing with organizations that's got multiple entities that are part of it. So it's very telling for me in terms of how I would eventually start having to deal more with governance. And that kind of gets into where things led into some AI things as well. But after 15 years there, I actually worked for Northwell Health in New York for about 7.5 years. I was there through the pandemic, which was certainly an experience that I'll never forget. Being in New York during the middle of that was it was not dull. It was quite overwhelming, to be honest. Hope we don't ever have to go back to it again. But I do have some unbelievable memories from the amazing people that I got to work with there. To this day, I reflect back, and what I saw was the best of humanity.
Mhm.
My own team was just unbelievable. Very impressive to me. So I was there for, like I said, just about 7 years. Then the last couple of years, I was at LifePoint Health, based here in Tennessee. And then back in the springtime, last year, it was right around this time. it became obvious from what I was detecting out in the marketplace and talking to people in my network that there was a demand for really a lot of focus around AI implementation, readiness, data readiness, which is a really big challenge for organizations to grow by acquisition because they have data silos everywhere. Um, that along with the governance, not only from a data governance standpoint but also from an AI governance standpoint, it became obvious there's a demand that really warranted some attention. And after hearing from a few different people, I decided it was time to launch. And so that's kind of how I got here for Hutchins Data Strategy. Primarily, I'm focused on providing advisory services to executive teams. Also doing a little bit of matchmaking between founders and CEOs and like, capital funds, just VC firms, and sometimes family office investors are reaching out. I think the interesting thing for me is I was not intending to be doing that piece of it. I didn't really have much awareness of it until people started to reach out to me, and I was realizing that there's a really difficult place, and when you're dealing with healthcare, the provider sector, knowing how to figure out what are the things that they really need. And it's probably the bigger challenge is healthcare in the provider sector here in the U.S. in particular is not in line for some kind of a windfall at some point. So the cost of deploying these things is something that's always concerning. And so it's really an interesting challenge, but it's been fun for me getting to know, a lot of people in my network that I didn't know before, and understanding what they're doing with technology. There's a lot of excitement now, and I'm just like starting to do things through my podcast. I started a while back of connecting the right people who have a good cultural fit. They have an exciting idea. They have a mission, and putting them together with people who really want to fund it. That part's exciting to me because it's a way to move things forward in a way I'd never even could have imagined when I started. But that's it, and not so much of a nutshell. Maybe it's a full meal, but uh, that's kind of where I am now.
Sure. Fantastic. That's a great journey there. Can you dive a little bit deeper into what it is Hutchinson Data Strategies do and how you do it?
Sure. Yeah. So there's a few different things that I'm focused on, but I mentioned the AI readiness things and governance. Those things are two different areas, but they are related. And there's there's a couple of different challenges that I'm seeing, and one of them is really in the literacy part of it. And I don't mean it in a way that you might think. There's just a lot of buzzwords out there, and organizations are feeling a lot of pressure to move, adopt the new technologies. Um, Rightly so, but the unfortunate part of it is that it's hard to really figure out what are the right things to be prioritizing and what actually is it that you need. So I've heard AI tossed around almost like it's a verb. You want to AI this thing? I mean, it seems silly, but that's kind of how things are in a lot of places right now. And I find that leaders they have a lot of scope. Let me just put it that way. You have people running big health systems. Their scope is massive.
Right.
They don't have time to go to school and become an expert on AI and all the different layers of it. They really don't. So helping them to really understand is the utility of the different kinds of things, helping them to understand which tools and capabilities are used for or well suited for one use cases or another. For me, one of the things that I'm trying to help with is I'm trying to lead them to something that they can say yes to. Um, because there's all kinds of areas where there's going to be risk involved. And what I want to make sure is I'm helping them to only do the things that actually they can be confident they can defend themselves with. Because there's all kinds of legal proceedings that are in different parts of the country in the U.S., probably elsewhere as well, that things are going to shake out and we'll figure out what we can and can't do. But
Uh-huh.
there's just a lot of things that have gotten out ahead of things from a what's good for healthcare perspective. And the recent emergence of OpenAI and Anthropic in the Gen AI space for healthcare has kind of put some pressure on now. We have to really figure out the governance pieces of it. So
Yeah.
That's really the short-term focus that has kind of shifted into that space because of the pressure that's there at the moment. But the really critical piece that is difficult is the data strategy of it. Um, Organizations that grow by acquisition have massive challenges when it comes to integrating data. Interoperability in healthcare is, I hate to even put the words together because a physician will tell you that we're not really seeing interoperability. There's still data silos everywhere, even for organizations that have migrated to one platform. So helping organizations to understand what is your current state of readiness. You might have some really great use cases, but if your data is not in a position where you can trust it and you know that you've got a complete set of data, that's just going to add a bunch of risk. So the really in the early going, what the assessment is trying to do is understand readiness from the data standpoint, the uh, subject matter expertise that's necessary in whatever space we're talking about. Do you have the right technology teams that can do it? How are you positioned from a legal and risk and compliance standpoint? Have you set some policies up? Do you have a team that's going to govern which use cases and determine which uses you're going to do? Um, and there's got to be some perspective from all kinds of different parts of an organization. I mentioned legal, risk, and compliance. Yeah, these guys are pretty concerned about the risk factors because there's just a lot of scrutiny always in healthcare.
Uh,
But that's a place where there's a there's a tendency, in my experience, for the stop sign to be put up. Anytime you get anywhere near something that feels like a third rail, and AI can feel that way, that's really a barrier that they're struggling with. So it's really it's a full gamut of things that I'm looking at it from, and one of them is also the human part of it. Um, it's an inherent thing that I think we all can put our finger on, that there's been an erosion of trust in human relationships. It's certainly the case inside of the corporate dynamic. But that's an area we have to look at too, is what is the workforce readiness looking like? And what are the things that we need to start thinking about if we're going to lean into, some of the AI technologies that are out there?
uh,
I mean, there's other aspects to it, but as right now, those are the ones that I'm most heavily focused on because that's where the demand is.
okay, great. And what type of company or organizations generally use your service? And is there any particular process or task where you see they're falling short in terms of their governance and compliance, which you identify more than others?
There's a wide range from small to large organizations. They have different levels of readiness, and part of that is even what they might have in place from an organizational structure standpoint. Some may have some level of governance structure, which is great. It's a nice, really that's an easier place to start. But the exercise of just identifying who the right people are, I mean, that's something I can certainly help them with, and that's typically part of it. Um, but the the difficulties that the organizations have right now is just they're very, very constrained. They have a lot of technical debt, which is really kind of bogging them down. I think that one of the bigger challenges over the last several years is that there's been a really push to migrate everything to a cloud, which is obviously the intent of that is a good one. But the difficulty is they also are thinking that they have solutions in place that they really don't have there. These cloud solutions actually don't clean your data for you. They don't organize it. They don't teach your team how to steward data, or what that actually even means. So there's a wide variety of things depending on the organization that you dial up or dial back the services you provide. But typically go through a 60 to a 90-minute consult that I do. The first one of those that I would do is free of charge, to really kind of understand where they are enough to be able to determine how I can help them, what recommendations I can make to them to get them started. Again, one of my main objectives is find a place where they can say yes to something and start making some progress. And if we can find one data source that's actually in reasonably good shape, that's obviously a good place to start. And it's so important to get a good win under your belt to start building some confidence in within the organization, that you've got some real opportunities. But there's tons of areas, in almost any organization where you can get some early wins and really demonstrate the viability and the value proposition. But it's not start with the dream use case because you got some cool technology. You've got to really look at where you're in a really good spot from a data quality, data completeness standpoint, and you've got the people that can champion it and really advocate for it across the organization.
Great. And can you share any real examples of how customers have used Hutchison data strategies to achieve meaningful results?
The it- situations that I've been working with so far, I mean, honestly, there's two different ones. Some of it's actually just working to connect people. So, working with a group that I'm not sure. Yeah, I have NDAs in place, but I just want to be careful.
Yeah,
Um,
yeah.
but they're doing some really fantastic work in the provider sector. They're using some AI and getting them into contact with some provider groups and helping them to start figuring going through the process of really testing the technology in a real scenario. Those are some of the connections that I'm making right now. And there's interesting progress there because I think it's going to probably open some doors to other types of utility for data for processes that are really built around a clinical encounter. But there's really exciting developments. I'm sure your listeners have heard a lot about ambient listening or AI scribes or documentation. That's one of the big areas of opportunity that exists because the electronic health record over a number of years. Well, first of all, it was actually built to really help to be more accurate in capturing billing information. It was never designed to support clinical workflows, and so unfortunately, once the potential of it started to be realized, we started to figure out ways we can measure quality better. Then, it seemed like every year we're just adding more and more things that clinicians actually have to capture and measure, um, which I hope people haven't had too many of these experiences. I know I've had some where I was in the doctor's office and I think they spent more time looking at their monitor than they did talking to me. But that's something that we've done to them. And the worst part is it's gotten to this point now where they actually have a term where I spoke with a physician a couple months ago. He started mentioning pajama time. I'm like, what is that? And he said, that's the time after I finish my day and I'm home theoretically, with time with my family. Um, Once everyone settles down, is ready for bed, that's when I actually get online and I finish my documentation. Uh,
Wow.
that was very alarming to me, but that's the kind of the technologies that I'm talking about, and we're bringing people together to really push on this to make sure that we're aiming at the right things. The idea is you want to improve the quality of the encounter, but you also want to give time back for that encounter and give time back to the clinician who's actually probably exhausted after doing a full day of in the clinic, and then we want them to go write a novel, and it's basically checking boxes for them.
Right.
And so it's exciting because I'm starting to see some traction between some of the organizations that they're connecting with, and for me, it's fun because I'm learning a lot, and there's a lot of things coming. I think over the next couple of months that will probably people start to hear more about it because it is very very effective, and it isn't aimed at AI for the sake of AI. It's really aimed at giving that time back. And so I've been, got a couple of other clients that I'm talking with right now that are, I think, going to be ready to go on that very shortly. But I have to be cautious with my my own excitement about it because I know what it can do, and I'm hoping we can just get folks across the finish lines again. The financial constraints that organizations have is unfortunately that's a barrier still in many cases.
In terms of these clients, what's the biggest challenge or bottleneck you're facing in terms of them implementing your solutions, or even you acquiring these, acquisition of these clients?
Yeah, there's probably two different things I'd say. There's a lot of organizations that are actually in the middle of a data migration or transitioning from their electronic health records. those are not small projects, and they're usually quite expensive. So, that's really one of the bigger challenges. But then if there's 70 projects in an organization, probably, more than half of them are really small use cases. And the challenge there is that there's not an easy way unless you actually have a governing body that's helping to determine which things you're going to do.
Uh-huh.
It's the fact that there's so many these solutions providers that are coming in through all kinds of gates into an organization, and you've got your radiologists have this really exciting solutions they want to do, but wait a second, the heart surgery space, they've got some really cool things over there. So where do we put our time and our energy? How do we prioritize it? How do you
Mhm.
decide? If is it an ROI concern, or is it a clinical quality or an outcome concern? The structure to actually do that assessment is the probably one of the more challenging things right now, because organizations are just starting to figure out what the composition of that team needs to look like to make
Uh-huh.
sure that you've got the right criteria to assess what are the things you're going to be executing on.
Okay, great. And what makes Hutchinson Data Strategy different from others trying to solve the same problem?
I love that question. Uh, the main differentiator for me is just the years that I've spent on the operational side of healthcare. Um, I'm not a clinician by training, that's for sure. But for the years that I've been in healthcare, it's been from learning everything from the ground up. Literally from first, supporting a small practice, doing all the coding and billing and things of that nature, and then getting into systems, electronic billing activities. I mean, they were using magnetic tapes to post payments when I started. I don't know if there's probably not a lot of people that remember what those even look like. Um, but really understanding the inside out from the inside out is the main differentiator. It's just years of working and supporting leadership teams inside of healthcare organizations. We're talking about organizations who are very, very sophisticated and well developed. And, the first 15 years at Dartmouth Hitchcock were things that really helped me to understand foundational aspects of it, but then really starting to learn and lean into the relationship aspect of it. If you want to be successful, one of the things you've got to be really good at is figuring out who are the people that you need to be working with, and quickly understanding what the demands are so that you can actually support and manage risk alongside of them. And sometimes you have to take it on, on their behalf. Um, but the interactions with people at all levels of the organization, whether it's the person that's checking in a patient at the front desk, or if it's the executive who's got responsibilities for clinical activities in addition to actually the administrative oversight of the organization.
Uh-huh.
But from one end to the other, I've been involved in supporting that for my entire career, and I think that's probably the main difference. Is that's where I learned to do this, and it's kind of again all about the people. It's all about relationships at the end of the day,
Uh-huh.
and to make things happen, you got to focus on the right things, and you got to be able to support the mission of the organization. I think that's probably one of the challenges, because healthcare is so complex. And
Uh-huh.
it's taken me 30 years to understand the complexity at the level that I do.
Sure. And where do you see the biggest opportunities for impact within healthcare right now?
I think that the pieces that are most critical, we've touched on it a little bit. The first is giving the time back. It's not as hard as people might think it is, but the critical piece is talking to the people that are doing the work, whether it's the nurses or it's the clinicians. They have
Right.
pain points. If you ask them, they'll tell you. They'll tell you exactly what they are. And one of the areas that I'm trying to be as vocal as I can be is really when we're talking about the ROI, it really can't be just about the efficiency. In our history, whenever we're implementing technologies, we're looking for efficiencies. That's what we expect out of it. Efficiency in this case has got to be about the encounter itself. It can't be only, well, if you've got 50% more less time doing your documentation, then you should be able to see 50% more patients. Well, no, when if they're already working till 11 o'clock at night, that's the wrong measurement for us to be using. It really has to be focused on what is the right thing. If you're not, let me put it this way, if you're in a position you're responsible for data and analytics or IT or whatever, you're going to have to start really standing up for the folks that are doing the clinical care and make sure that you're steering and influencing the organization in the right way to start to really work on this and give some time back. So we're talking about burnout at unprecedented levels that clinicians are going through, the nurses as well. But in reality, the way things have evolved over the last couple of years, it's coming out of the pandemic even, everyone's feeling levels of pressure and probably has symptoms of burnout that may not even be aware that they're dealing with it just because you get numb to things over time. But it's really this space where dealing with it for dealing with the governance piece of it, but through not through the lens of control, but through the lens of what are the right things for us to enable now that actually are going to be the best suited to solve problems for the people that are receiving the care and the people who are providing the care.
Fantastic. And what's next? How do you see Hutchison Data Strategies evolving over the next few years? And what does growth look like for you?
This is an interesting one for me. There's a lot of work that I'm doing in the advisory space, not only for providers but for startup companies and more recently some investment firms. And it appears as though that's going to continue to be an opportunity. And there's some things that I'm working on with a business partner relative to the behavioral health space that I'm kind of excited about because I think there's some opportunities there to do things that'll have global impact at scale. It's a passion thing for me more than anything in that space. But there are some technologies that I've become aware of that I think we can actually learn from and adapt to other industries that could potentially help us to feed funding back into the behavioral health space because it has been neglected for such a long time. And unfortunately, it's very undercompensated, at least in the States. And that's an area that we've got to do better about because there's a lot of people out there that are hurting. And I think with the opportunities, if I can find some more people who just want to do some good, uh, I think guys, that's kind of where I see things going. And I think there'll be some kind of global initiatives that'll come out of some of the things that I'm talking about. And I'm not telling you this because I've done all this stuff. I'm meeting people who are actually starting to work in these areas and really spread their wings. So I expect there'll be some opportunities there for a lot of people that I've have in my networks. My intent was never to build an army for myself, but knowing so many people that have depth and a really solid workforce that are really trained like data engineers and such, that's really an important thing for me to be able to do because I don't want to reinvent the wheel and I don't want to build something where I know that there's people who are already well equipped to step into some of these opportunities and really deliver. So
And is that moving away
the
from the healthcare space then,
it won't be moving away from it, but it'll definitely be expanding beyond it.
expanding beyond it?
Yeah, because a lot of the value stuff that I'm seeing, I just think it has a lot of opportunities outside of it. There's it's interesting thing with the ambient listening stuff. You think about the voice agents, there's multilingual aspects of it. Um, there's an empathetic side of things where people are using like these voice agents now because it's not human. You can actually talk to it, and you can pick the personality type, or even if you want to, and you're talking to somebody who's pretty even keeled, that they're not being impacted by the chaos in an office, right?
Mhm,
Those types of things, if you can really build in some flexibility to really be able to be attentive to what people are saying, pick up tone, intonation, that kind of stuff.
mhm,
There's some opportunities there across other industries as well, because there's an empathetic piece of that. I want to be careful about encouraging us to go too far in making it seem human. But that empathetic piece of it, for me, is when if you can detect when someone's really upset, has anxiety, that can actually affect how you can help them. And for me, I don't know about you, but I've been on on hold I don't know how many times for various things in almost every industry that I've ever worked with, and it gets really, really frustrating.
Hmm.
Uh, and it would be really nice to, in some instances, if there's somebody there or there's some process in place that you're working through, that you at least feel like somebody's listening, and maybe there you have a shot at resolving the thing that you're trying to get resolved with some specificity, with not somebody just reading a script or quite frankly reading the instruction manual that you might have right in front of you while you're talking to 'em.
Sure, sure. Very interesting. Well, thank you, Chris. And where can people learn more about Hutchison data strategies or get in touch with you or your team?
Well, thank you so much. People can find me on LinkedIn. It's just Chris Hutchins. That's the easy part. But I also have a website. You can find me at hutchinsdatastrategy.com. And you could, if you're looking for like, more content, there's a press and media tab there as well. But you can also find me on the signalroompodcast.com, where I've got a lot of interesting people coming at healthcare and AI from all directions. So feel free to reach out.
Brilliant, Chris. Thank you very much. Anybody who wants to learn more, please reach out to Chris. And thank you for your time, Chris, and all the best.
Thanks so much, Rodrigo. I really appreciate the opportunity.